Jim, let's talk for a second about how practices market themselves. We had an evolving landscape prior to COVID with a move towards social media and so forth. How do you see that changing in the future? Is it even as necessary if there's such a demand for doctors' care?
Well, John, the clear, direct answer is they better change their practice because it is going to be a requirement. Again, back to what we've been discussing, that office is going to be different. You're really going to need to understand what your practice is. Is it a specialty practice? It is a universal practice, and then you're going to have to reduce your cost to serve from an administrative standpoint. The other challenge is, are you going to have a mix between reimbursed and non-reimbursed? I do believe discretionary pay is going to be a challenge. And so I think you're going to be challenged by the patient who had a discretionary pay checkbook. I don't know if, at least over the next 12 to 18 months, we're going to see discretionary pay on some of these specialty products as great as it was before. But if it is, you should make sure you're aligned there. The other one is, I do think you need to identify what patients you were looking at before and see if you can accelerate and get them into practices. I think personally, it's going to be a market share gain. Very interesting how my industry works. We try to grow the market, but of course we're competitors and we look at market share. I think your practices are going to start looking at market share. How much of my market do I really own? And how do I capitalize on those patients out there? So it is going to change. And I will relate one more point that you've been so consistent in this discussion. If you haven't set your practice up today to use a diagnostic platform, you're already behind the eight ball. So better get ready now, because practices like Dr. John Hovanesian, who know how to properly identify patients and use that cost to make them more productive, are way ahead of you. And so I would start to think about that like today.